Good morning. So today we are going to see about the fifth cranial nerve, that is the trigeminal nerve. And because of its very wide distribution and of course important relevance to all dentistry students, we are taking this cranial nerve separately, and we shall see about its relevance with regard to its origin, course, distribution. So, as the name suggests, the trigeminal, it means there is three divisions. So, in many books, the authors, these trigeminal would be denoted as V1, V2, V3, in the sense which signifies its three divisions. So, we shall see today about, of course, this is a mixed nerve, and therefore its relevance is also again important. The function is that the motor part is supplying to the muscles of mastication. Therefore, the muscles that move the jaw, the lower jaw, is being supplied by the branches coming from this trigeminal nerve, and also the tensor tympani muscle, which is seen in the middle ear. So these are the motor supply, but uh, equally or more important is the very wide distribution of the sensory branches that is supplying to the face as a whole. When we say the face, the including the scalp and of course the cavities. So in this case, we can see that there is a very wide distribution to the upper part of the scalp or the anterior part of the scalp, and then that is coming from ophthalmic nerve division B1, and branches to around the eye, which is also therefore that name which carries its significance. And then there is the maxillary division, which is taking sensations from the middle part of the face, and then the lower division, which is called as mandibular, which is taking sensations from the lower part of the face, and it is the mandibular nerve which also carries the motor branches or these motor supply to these muscles of the mastication. So therefore there is both motor and sensory functional components. The both of these components are lying in the pons predominantly, even though the sensory component or one of the sensory component of the trigeminal is seen throughout the brainstem, that is seen in the midbrain, it is seen in the pons, it is also seen in the medulla. But the trigeminal nerve as such is attached or it is exited from the pons. So therefore, we do give emphasis to the nucleus lying in the pons. But to not forget is that the spinal tract of trigeminal nucleus is lying in the midbrain as well as in the medulla. The part which is lying in the midbrain, we generally call it as mesencephalic nucleus, and the part which lies in the medulla and to the upper spinal cord segments, we call it as a spinal tract of trigeminal. And the chief sensory is what we mention as the trigeminal nucleus in the pons. So this has a very close relation to the cerebellopontine ankle. The trigeminal nerve, after it exits from the pons, or which is coming out of the pons, will then be will then be seen on the apex of the petrous temporal bone, where you see there is close to the apex, there is a depression which we call as a trigeminal fossa. That is because that is where you see the trigeminal ganglion. And after or from this trigeminal ganglion is where we see the three divisions, that is the upper, middle, and lower, which we now called as ophthalmic, maxillary, and mandibular. Okay, so we can see here in this diagram the nerve which is coming out from the pons, which will have both, there will be a motor part and the sensory fibers, both. And then you will see it is forming this gasserion ganglion or trigeminal ganglion, which is situated just lateral to the apex of the petrous temporal bone. And then you can see the divisions, that is V1, which is otherwise called ophthalmic, the V2, which is called as the maxillary, and the V3, which is uh, the mandibular. So ophthalmic nerve or ophthalmic division in its distribution, we can see, of course, it passes through the cavernous sinus or the walls of the cavernous sinus, along with the cranial nerve number 3 and 4, which we have seen also passing on the lateral wall of cavernous sinus. And then after it exits from there, we will see it is distributing. The ophthalmic nerve can also be seen as it is passing through the superior orbital fissure, and then coming out of the orbit, it will give the or take sensations from the skin of the forehead, the scalp, the cornea, the conjunctiva. So these are sensory supply which the ophthalmic nerve is taking. Then to say about maxillary nerve, it is exiting the skull through the infraorbital foramen, and thereafter it takes the sensations from the middle part of the face. Therefore, the skin of the middle section of the face, that includes the nose region, the upper part of the lips, and the upper part of cheek, all that, and mucous membrane of the mouth, oral cavity, and the palate, along with the nasopharynx. So therefore, this sensory innervation is important for the dental students in particular. And of course, next, the mandibular is also very, very important, because it is, as I said, having the motor branches. So the motor branches are only passing through the mandibular nerves, not the ophthalmic or the maxillary. They are purely sensory nerves. But the mandibular is having the masticatory muscle branches, and also it is taking sensations from the lower jaw, the skin of the lower jaw, and the mucous membrane of the lower jaw occupying that part of the oral cavity. So this is roughly what it is taking its sensory supply from. So you can see here the ophthalmic nerve passing in the upper part and through the superior orbital fissure, and then we will see it is also giving branches. It will divide into lacrimal, frontal nerves. And lacrimal, of course, the name as it suggests, you can say it is going to the lacrimal nerve. But please understand, this lacrimal nerve, what we see coming from ophthalmic, is purely sensory. So that means it is taking the sensory feedback from the lacrimal nerve. So the secretomotor fibers to the lacrimal is not passing through this ophthalmic nerve, but we will see it later. And then the maxillary nerve, as we can see, as you see here, passes from the trigeminal ganglion and through the foramen rotundum. Through the foramen rotundum, it is then passing, and inside this part of the skull, it is giving rise to the pterygopalatine ganglion fibers. So the pterygopalatine ganglion is attached to the maxillary nerve while it is passing through this canal from the foramen rotundum in the pterygopalatine fossa. Then the remaining part of the nerve is exiting out of the skull through this infraorbital foramen, through the infraorbital foramen. So while it is passing or while it is coursing to the foramen, it will also take the sensory supply. You can see the sensory branches which is going to the upper jaw, the upper alveolar region, and including the maxillary sinus. So the maxillary sinus innervation And the upper jaw, you can see there are mainly anterior superior and posterior, middle superior, and posterior superior alveolar nerve. So all these alveolar nerves, that is anterior, middle, and posterior, they are branches of the maxillary nerve before it exits out of the infraorbital foramen. After it exits from the infraorbital foramen, you can see it is giving sensory branches to the to the lower part of the eyelid, or the adjacent part of the skin of the nose, and then also from the upper lip. So these are branches of the maxillary. So therefore, maxillary has its importance. One, that it is having the connection to the pterygopalatine ganglion, and then of course all the alveolar branches of the upper jaw, that is anterior, middle, and superior, including to the maxillary sinuses, and then the sensory supply of the face branches which are coming out after it exits from the infraorbital foramen. So that is about the maxillary nerve importance. So in summary, the ophthalmic nerve, the functional component is general somatic afferent, because it is general sensations which it is carrying. You will see the neuronal cell bodies in the trigeminal ganglion. The exit is through the superior orbital fissure for the ophthalmic nerve, and as it is coming to the orbit, you will see it will give tentorial branches, probably before it enters the supraorbital fissure, and that is, of course, that is otherwise the meningeal branches, we can say, supplying to the tentorium cerebelli and the adjacent uh, meningeal layers, which is lying there. Whereas the lacrimal, frontal, and nasociliary, these are the three branches which are going to pass into the orbit. And then they are going to distribute, uh, taking sensations from the upper eyelid, the forehead, the anterior part of the scalp, the nose adjacent skin, the cornea, the conjunctiva, and lacrimal gland. So, as I told before, there is sensory branches to the lacrimal gland, and the secretomotor fibers to the lacrimal gland will also pass through the lacrimal nerve. But it is to be remembered that the lacrimal gland fibers, that is the preganglionic fibers, they are coming from the facial nerve, okay, not the trigeminal. But the postganglionic fibers, of course, needs to take the help of the lacrimal, of this lacrimal nerve, and to reach to the lacrimal gland. So the preganglionic fibers for the lacrimal gland is associated with the facial nerve, but the postganglionic is coming from the facial. So that is about ophthalmic nerve. Maxillary nerve, as I mentioned before, its summary, we can say the general somatic efferent again, because it's only taking general sensations, passing through the foramen rotundum into the pterygopalatine fossa, and then the main exit is the infraorbital foramen, where the sensory branches taking the sensation from the face is going. But whereas those branches which are going to the upper jaw, they will exit before, or they will come out before the infraorbital foramen, and they will supply or take sensations from the lower eyelid, the upper cheek, upper lip, upper teeth, and the maxillary region, otherwise which we generally mention. Now, these are what we can see as it is passing through the foramen rotundum, and before it comes out from the infraorbital nerve, these alveolar nerves are coming to supply. Now, the most important branch of trigeminal with regard to its distribution because of its motor supply is, of course, the mandibular nerve. So, mandibular nerve, we can see it has got both afferent and efferent. So, afferent part is, we can see taking sensation from the lower jaw and the mucosa of that part, and to be noted is the branches, because it is giving meningeal branches sensory, buccal branches sensory from the face, auriculotemporal nerve, which is sensory as well as important because it carries parasympathetic fibers, through this auriculotemporal to the otic, to the parotid gland. And then we can see lingual nerve. Lingual nerve is again important because of its uh, mandibular branches and its suspending submandibular ganglion fibers, which is from the lingual nerve, inferior alveolar nerve again, which is also taking sensation from the lower jaw. And the motor part, so both of these, that is together, the mandibular nerve exits from the cranium through the foramen ovale. But then the motor part is supplying branches to the masticatory muscles, tensor veli palatini, mylohyoid muscle, anterior belly of digastric, and tensor tympani. So definitely the mandibular nerve for dental students will be taken separately along with maxillary nerve because of its very wide distribution. But we are here just mentioning only where all it is distributing or giving branches. So that is about the motor. So this is the motor branches which are coming from the mandibular after it exits from the foramen ovale. So as it exits from the foramen ovale, we can see a branch going behind, that is the auriculotemporal nerve. But then we can see other motor branches which are going to other directions. One group going above, that is to the temporalis, and then other groups which are going medially, which is to the pterygoids muscles, lateral and medial pterygoid muscle, and then another branch going to the masseter muscle. So all these masticatory muscles are getting the motor branches from this mandibular nerve. And other than that, you can see the lingual nerve, which is also going to take or give supply from the tongue, and the inferior alveolar nerve, which will pass through the mandibular foramen and the mandibular canal, which is taking those sensory branches to the lower jaw and the teeth. So that is the inferior alveolar nerve, whereas the lingual nerve is more important with regard to its distribution to the tongue, as the name suggests. So it is this lingual nerve which will also have the submandibular ganglion carrying the parasympathetic fibers to the submandibular and sublingual gland. So this is a summary of how the trigeminal nerve in its distribution is. The ophthalmic, you can see the branches supraorbital, supratrochlear, and then the lacrimal nerve, and then the nasociliary nerve, which is giving rise to the infra orbital branch. And the you can see the anterior ethmoidal, posterior ethmoidal. These are some of the branches coming out from the ophthalmic. The maxillary we can see here, which is passing through the foramen rotundum and then the infraorbital foramen. And before it comes out, it gives those alveolar branches to the upper jaw. And the mandibular, you can see here, it is giving rise to the sensory branches, that is buccal and lingual, and the inferior alveolar nerve, along with auriculotemporal nerve and motor branches to the masticatory muscles. So this is the summary of trigeminal, and because of its very important relevance to the sensory and motor divisions, we can say it is a very important nerve to remember for in the cranial nerves. So hope you could understand the relevance of the fifth cranial nerve, the trigeminal nerve. Thank you.